Hey, it's Brandi Kruse. You're watching a clip from our weekly show, Sundays with Subscribers. To get access to full episodes and more, become a subscriber to the show by visiting undividedpod.com.
Nothing in this requires the state to do anything as it relates to taking kids away, right? Some of the things that we've heard in some of our testimonies. And the irony is, and you've kind of alluded to it too, is where you heard the testimony. So oftentimes some of the people who are saying that this is about parents' rights, well, just based off of the hyperbole that I'm hearing on my tweets, on my emails, some of the very vitriolic and very vile language that I receive as just a sponsor of the bill in public, I can't imagine what's being done, in private as well.
Do you think it's possible that in your efforts to do what you say the bill is intended to do, that you could be cutting out loving parents who just have some concerns about their child getting that kind of protected health care?
If it was, well, no, because I don't think that it prohibits young people from being able to work with their parents to figure out a solution as well.
But if they want to, the kid can't.
Yeah, there's nothing that prohibits them, and there's nothing that forces them to go anywhere. The state's not doing anything. It's certainly in a case where, okay, you're now in a situation where there's a young person who is unhoused, who needs care, who has potentially been exploited, can't get access to something, right? So none of this is trying to take kids away from their homes. It's only after something happens, we're trying to provide a network of support to get them in a spot where they can get some help.
But when you say something happens, that could be a parent just telling their kid, I don't want you to get X protected health care. And that could be something that happens and a kid ditches it to a shelter and then their parents are like, where's my kid?
So
I feel like your bill assigns the worst intentions to parents. When I think there's a lot of parents who want to talk through it with their kids and don't want their kids to have an option to run away to a shelter where the state won't give them their physical address.
Well, and the way that this conversation is even going is kind of to the point, right? So it's funny, we had another conversation online about gun control that I'll bring it back up later.
Yeah.
I'm trying to protect young people who don't feel safe and who are oftentimes unsheltered and the highest rates of either trafficking or abuse or violence and even suicide. So my goal is to protect young people in some of their most vulnerable moments of their lives. Mm-hmm. That's my goal. If in certain cases where there happens to be a very loving parent who got into it with their young person and they can't figure it out, I'm like, okay, potentially, but my goal is to help this young person become stable, feel safe, so that they can become in a mindset where they can actually get the services they need and hopefully reunify with their family. That's literally one of the intents of the bill. That's why they have to go to DCYF. That's why we want to make sure that they have these provisions in place. So it's just a matter of who we're trying to serve. And in this case, the problem that I see isn't that there are loving families that have kids running away. No, the problem that I saw was that there are kids who are running away because they are not in a safe spot and they need help.
Yeah, but there are some people who would say, why do you think it's your job to do that? I mean, it's not physical abuse that we're talking about.
Sometimes it is. I mean,
but then there are laws for that.
That's right.
There are already laws for physical abuse. So what you're talking about really is disagreement between a parent and a child, albeit disagreement on a serious issue, protected health care. But to me, the bill almost equates, because before this law, before 5599, if a child were to run away from home and show up at a shelter,
yeah,
there was like really only one instance where they wouldn't tell the parent where the kid was, and that is if they were abused.
Yeah, signs of abuse.
So now there's two. It's protected healthcare, signs of abuse. So to me, now you've likened a parent who's physically abusing their child to a parent who didn't want their kid to get gender care or an abortion.
Well, I think the context that's missing is that the level of vitriol towards especially transgender youth is at a height that I've never seen before. If you look at the rates of suicide or even ideations of suicide amongst that specific demographic, it is at astronomical levels as it relates to the general population. There is actual harm that is actually happening today, whether it's self-inflicted or imposed on them as well. So that's why it's so important, is that people are actually dying because of whatever dynamic that is happening at home.
But I asked you a couple minutes ago, do you think that someone is a bad parent if they don't support their child getting that kind of care? And you said no.
Well, I don't think they're a bad parent, but that's not my goal in this bill. My goal is to protect young people who feel as if they're not in a safe space.
And what would you say to people who see that as you believe you can parent better than they can?
Fine.